Brain fog is common, but sometimes it's not just stress. If your thinking feels off and it's starting to affect safety, work, or relationships, you need a clearer line between normal distraction and a medical red flag. Here's the key idea. Brain fog is a symptom, not a diagnosis. It can come from sleep problems, mood issues, hormones, infections, medications, vitamin deficiencies, or neurological conditions. Most causes are fixable or manageable, but the timing matters. Certain patterns mean you shouldn't wait it out. In this guide, you'll get a simple checklist of warning signs that deserve a call to a clinician. You'll also learn what details to track, so the appointment is actually useful. The goal isn't to scare you. It's to help you take your symptoms seriously, without guessing. If you recognize one of these signs, treat it like information. Moving to slide 2. First, let's define brain fog in a practical way. It usually means slower thinking, poor focus, forgetfulness, mental fatigue, or feeling not fully present. That can happen after a bad night of sleep or a stressful week. The medical concern rises when the fog is new, persistent, or clearly different from your baseline. A helpful question is, what changed? Did it start after an illness, a new medication, a major life event, or a change in sleep? Another key question is, what's the impact? If you're making unusual mistakes, missing appointments, rereading the same paragraph, or struggling to follow conversations, that's more than mild distraction. Also pay attention to whether it fluctuates during the day. Some causes have patterns, like worse mornings, worse after meals, or worse with exertion. You don't need to self-diagnose. You just need to notice the shape of the problem, because that shape helps a clinician narrow down what to test and what to rule out. Moving to slide 3. Warning sign number 1 is sudden onset, especially over minutes to hours. If you feel abruptly confused, disoriented, or unable to think clearly, that's not the typical foggy day. Sudden cognitive change can be linked to things that need urgent evaluation, like stroke, seizure activity, severe infection, dangerously low blood sugar, or medication reactions. Another version is sudden brain fog with a severe headache that's unusual for you, or sudden fog with weakness, facial droop, speech trouble, vision changes, or trouble walking. Even if symptoms partially improve, it still matters. Some events come and go, like transient ischemic attacks, and they can be a warning for something bigger. The safest move is to treat sudden, dramatic change as urgent. Don't try to power through it or sleep it off. If you're not sure whether it counts as sudden, use this test. Could you clearly point to the moment things shifted? Moving to slide 4. Second warning sign, brain fog that steadily worsens over weeks to months. Gradual decline can be easy to rationalize. You adapt, you compensate, and you tell yourself you're just tired. But a clear downward trend deserves a medical workup. Worsening fog can come from thyroid problems, anemia, sleep apnea, vitamin B12 deficiency, chronic inflammation, depression, medication side effects, or neurological conditions. The reason progression matters is that it helps separate a temporary state from an underlying process. Look for clues like needing more reminders than before, getting lost in familiar places, struggling with tasks you used to do automatically, or feeling like your mental bandwidth keeps shrinking. If people close to you notice changes before you do, take that seriously. A clinician can check basics like blood counts, thyroid markers, nutrient levels, and review medications. The earlier you check, the easier it is to catch reversible contributors. Moving to slide 5. Third warning sign, brain fog plus neurological symptoms. Fog by itself can be vague, but fog with specific nervous system signs is more concerning. Examples include new tremor, numbness or tingling on one side, new clumsiness, frequent falls, changes in vision like double vision, or trouble speaking clearly. Another big one is new seizures, even subtle ones, like staring spells, sudden blank moments, or unexplained lapses in time. These combinations can point toward issues affecting the brain, spinal cord, or nerves. That doesn't automatically mean something catastrophic, but it does mean you want a clinician to evaluate it, and sometimes imaging or specialist referral is appropriate. Also watch for new bladder or bowel control problems paired with leg weakness or numbness. That mix can be urgent. The takeaway is simple. When brain fog shows up with body signals from the nervous system, Don't label it as stress and move on. Moving to slide 6. Fourth warning sign. Brain fog that comes with major personality or behavior change. This is the kind of shift that family, friends, or coworkers often notice first. Maybe you're unusually irritable, impulsive, apathetic, or emotionally flat. Maybe your judgment is off in ways that feel out of character. Sometimes this is tied to depression, anxiety, trauma, or burnout. But it can also relate to sleep deprivation, substance effects, hormone changes, or neurological illness. The reason this matters is that cognition and behavior are tightly linked. If the fog is paired with big changes in motivation, risk-taking, social behavior, or emotional control, it's worth a professional evaluation. Include sleep and substance use in the conversation, including alcohol, cannabis, and stimulants, because clinicians need the full picture to interpret symptoms. If you ever have thoughts of self-harm, that's an urgent situation. Moving to slide 7. Fifth warning sign. Brain fog with sleep red flags. Poor sleep can absolutely cause fog, but certain sleep patterns suggest a medical issue, not just a bad routine. The big one is possible sleep apnea, loud snoring, choking or gasping at night, morning headaches, dry mouth, or extreme daytime sleepiness. Sleep apnea can fragment sleep and reduce oxygen, and studies link it to cognitive problems and cardiovascular risk. Another red flag is acting out dreams, sleepwalking in adulthood, or sudden muscle weakness triggered by strong emotions, which can point to specific sleep disorders. Also pay attention to insomnia that's severe and persistent, especially if it's paired with racing thoughts or mood changes. If you're sleeping 7 or 8 hours and still feel unrefreshed, that's useful information. A clinician might recommend a sleep study or targeted screening. Treat sleep as a medical vital sign, not a personal failure. Moving to slide 8. Sixth warning sign. Brain fog with systemic symptoms, meaning your whole body seems involved. Think fever, night sweats, unexplained weight loss, persistent swollen lymph nodes, new rashes, joint pain, or ongoing digestive issues. Brain fog can show up with autoimmune conditions, chronic infections, inflammatory disorders, and even some cancers. Again, fog is not specific, but fog plus something else is clearly wrong is a strong reason to get evaluated. Another systemic clue is new intolerance to heat or cold, hair loss, or constipation, often seen with thyroid imbalance, or frequent thirst and urination, which can suggest blood sugar problems. If you're having repeated infections or feeling unusually wiped out after minor exertion, mention that too. The point is to connect the dots. Clinicians think in patterns, and systemic symptoms help them choose the right labs and next steps instead of guessing. Moving to slide 9. Seventh warning sign. Brain fog that starts after a new medication or supplement or after a dose change. This is extremely common and often overlooked. Many classes can affect attention and memory, including some antihistamines, sleep aids, anti-anxiety medications, certain pain medicines, some antidepressants, and medications that lower blood pressure. Even natural supplements can interact with prescriptions or cause sedation. The key is timing. If the fog began within days to a few weeks of starting something new, that's a strong clue. Don't stop medications on your own. Instead, document the exact product name, dose, and start date, and bring it to your clinician or pharmacist. Also mention alcohol use, because it can amplify sedating effects. Another overlooked factor is polypharmacy, lots of small effects stacking up. A medication review is one of the highest value, lowest risk steps in evaluating brain fog. Moving to slide 10. Eighth warning sign. Brain fog with headaches that are new, worsening, or neurologically different. Many people get tension headaches or migraines, and brain fog can come along for the ride. But get checked if your headaches change pattern, become more frequent, wake you from sleep, or are triggered by coughing or straining. Also take seriously headaches with fever, stiff neck, confusion, or new neurological symptoms. Another important pattern is headache plus vision changes, especially if you notice brief vision dimming, double vision, or a new blind spot. If you're over a certain age and headaches are brand new, clinicians often evaluate more carefully. The goal is not to assume the worst. It's to rule out conditions where early detection matters. When you describe headaches, include location, intensity, duration, triggers, and what else happens with them. Nausea, light sensitivity, or cognitive slowing. Moving to slide 11. Ninth warning sign: brain fog with heart, breathing, or circulation symptoms. Your brain is sensitive to oxygen and blood flow. So if fog shows up with chest pain, palpitations, fainting, severe shortness of breath, or new exercise intolerance, it deserves medical attention. Anemia, heart rhythm problems, low blood pressure, and lung conditions can all reduce oxygen delivery and make you feel mentally slow or detached. Another clue is dizziness when standing, sometimes linked to dehydration, medication effects, or autonomic issues. If you notice your fog is worse when you stand up, after hot showers, or after meals, mention that pattern. Also consider carbon monoxide exposure if multiple people in the same environment feel headaches and fog, especially in winter or with fuel-burning appliances. That's an emergency. The main point: when cognitive symptoms pair with cardiopulmonary symptoms, don't treat it as just brain stuff. Moving to slide 12. 10th warning sign: brain fog that interferes with safety or basic functioning. This is a practical threshold. If you're unsafe to drive, you're leaving the stove on, you're getting lost on familiar routes, or you can't manage bills or medications the way you used to, that's not a wait-and-see situation. The same goes for work errors that are unusual for you, especially in jobs where mistakes can harm people. Even if the cause ends up being sleep deprivation or anxiety, the level of impairment still matters. Bring examples, not just feelings. Say, I missed 3 deadlines, or I forgot my child at pickup, or I've had 2 near misses while driving. Clinicians can assess cognition, screen for depression and anxiety, and decide whether you need labs, imaging, or referral. Function is one of the clearest indicators of urgency. Moving to slide 13. Now let's make the doctor visit efficient. Before you go, track 3 things for 1 to 2 weeks if you can. First, onset and timeline, when it started and whether it's stable, improving, or worsening. Second, triggers: sleep, stress, meals, caffeine, alcohol, menstrual cycle, exercise, and screen time. Third, impact: specific examples of what's harder. Also bring a full list of medications and supplements with doses. If you have a smartwatch, note resting heart rate trends or sleep duration, but don't let the data replace your symptoms. During the appointment, ask what they want to rule out first. Common first steps include checking anemia, thyroid function, B12, iron, blood sugar, inflammation markers, and reviewing sleep and mood. Sometimes the best next step is a sleep study or medication adjustment plan. The goal is a structured workup, not a vague reassurance. Moving to slide 14. Let's wrap this up with a simple decision rule. If your brain fog is sudden, worsening, paired with neurological signs, or affecting safety, get medical help promptly. If it's persistent and unexplained, schedule an evaluation and bring good notes. You're not being dramatic. You're being precise. And that precision helps clinicians separate common causes like sleep issues, mood disorders, thyroid imbalance, anemia, or medication effects from less common but more serious problems. One more thing. If someone close to you is worried about your thinking, treat that as useful data, not criticism. If you found this checklist helpful, consider subscribing for more clear, practical health explainers. And for a quick check-in, leave a comment. Has your brain fog been more tied to sleep problems or to stress? A or B? This information is not a substitute for medical advice.